So hi everyone. Hi again. Like I said, my name is Sanjana. I'm one of the founders of Miyara, along with Gayatri. We're both scientists by training, and we're very excited to have this webinar today because it's Menopause Awareness Month. October is Menopause Awareness Month. And that's why we're very excited to have Dr. Amodita here with us. But just to give you a brief introduction about what is Miyara. Miyara is an online health platform that was created to support women through midlife and beyond midlife, so perimenopause, menopause, and beyond. And how we do it is connecting women through to a community as well as experts such as Dr. Amodita here. But we also focus on 4 pillars, that is nutrition, mental health, gut health, and fitness. So we kind of put all these things together and, give customized programs for women. So today, as I said, is Menopause Awareness Month. And I'm very excited to have Dr. Amodita here with us. So I'll just give a little bit of an introduction to Dr. Amodita because I think you all need to know she's a really cool person and I'm glad we could connect. So Dr. Amodita is a consultant gynecologist, obstetrician, and laparoscopic surgeon. She's also the founder of an online consultancy and educational platform, Project Pink Butterfly, which was started in 2017. So the platform was started keeping in mind the anxieties and fears which every woman suffers by just seeing a gynecologist. These anxieties prevent the women from seeking the best possible care, and they often skip the annual checkups. So the purpose of starting this platform was to educate women, thereby making them less vulnerable and anxious and making them aware about the facts about their health. Not only that, she's a gold medalist. She's got 4 gold medals during her MBBS and was the university topper and best outgoing student in her postgrad. She's also super specialized in minimally invasive surgeries. And not only that, but during her education, she realized that most women, especially in India, are not able to express their problems because of the fear of being judged or embarrassed and feeling of some kind of intrusion into their personal life. And due to this lack of communication, their quality of care is jeopardized. She has written for many prominent newspapers and magazines, and her article, Sex After Menopause, became the most searched article on Google. So her goal is really to bring back the soul in healthcare, which is full of empathy, honesty, trust, and respect. So happy to have you with us here, Dr. Amodita.
Thank you so much. Thank you so much for having me.
Yeah, so let's just start off by just setting the stage kind of to really understand what is perimenopause and menopause and what are the common symptoms that women would experience during this time.
Okay, so basically, perimenopause is a transition from your reproductive life to an end of era of reproductive life. So perimenopause is a time when actually, the eggs which were there in your ovaries are about to come to an end. So that is the end of era of your reproductive life. And that's the end when after that you cannot become pregnant. And so during this perimenopause time, because the eggs are coming to an end, so there is a lot of fluctuation in the estrogen and the progesterone, that is the female hormones, that keep happening. And the shift is so rapid that because of that there are a variety of changes which happens in female's body. And menopause is something where the era has end, and almost for an year or so the female has not got her periods. So after the eggs have completely gone to drain, everything is over, and the hormones have also stopped, they are not produced in the ovaries. So because of that reason, for one year, if the female is not getting her periods, that's when we say that it is a menopause. So the symptoms, they differ between the perimenopause and the menopause. In the perimenopause, because the hormones are still there, but they're fluctuating up and down. So because of that, the symptoms appear. And the most common symptom which happens in the perimenopausal time is the hot flashes. That's like the first thing that, comes into picture, along with the mood changes and then vaginal dryness. And so these are the three most common things which happens, and along with that, change in the bleeding patterns. That when you'll notice that you will get your periods irregularly, that you are getting your periods in 2 months, 3 months, 4 months, and whenever you're getting your periods, they're lasting for 10 days, 15 days. So there is an erratic change in the your menstrual cycle. Then what is a hot flash? A hot flash is something where you're sitting in an AC room and suddenly you start feeling hot, your face is flushed, and you feel, oh my God, as if you have transited from a cold cap mountain, from a mountain to a desert. It's like that. So that's, and the hot flash usually lasts from 3 to 5 minutes, and the face becomes flushed. And if it happens in the night, we also call it as a night sweat. So this is about the hot flash. And the mood changes can range from being super happy to being completely anxious or depressed within a span of like seconds. And why it's happening is because the estrogen progesterone are changing so rapidly. Because of that, there is a direct effect on the happy hormone, that is serotonin, because the serotonin production is completely dependent upon the estrogen and progesterone. And when they are going up and down at such a rapid rate, the serotonin, the happy hormone, also goes up and down at such a rapid rate. And that's the reason the mood can range from sudden anxiety, sudden depression, sudden happiness, to sudden anger without any reason. So these are the few, like 4 most common symptoms which a female can experience during the perimenopause. And if you're experiencing this, you should know that you are entering into the perimenopausal state. Menopause, during menopause, so the important thing is that, estrogen, that is the female hormone, has some effect or the other on every part of a female body, and when the estrogen and progesterone goes down, when they are going to get depleted, every organ is going to affect. So the symptoms can range from, so if I keep telling my patients that you might experience symptoms ranging from top to bottom. So I'll start from the brain. So from the brain, you might experience some sort of a brain fog, that you don't know, the clarity which was there before, that goes suddenly. It becomes so difficult for you to remember things. And you suddenly feel that my brain memory is going down. That if you think that I have chalked out a list of few things I have to do in a day, suddenly you'll be like, what I have to do? I don't have to do anything. That brain fog, that forgetfulness, that comes first. Then obviously anxiety, depression, mood changes, insomnia, inability to sleep. Obviously that's because of the night sweats also that happens. But again, the insomnia is again a part of menopause. It's also because of the hormones which are, going down. So because of that, the insomnia happens. And also because of the anxiety, depression, which is associated with it. So these are the symptoms which are related to the brain. Then coming to the eyes. So anybody who is entering into menopause or who has attained menopause can have dry eye syndrome. That is, if they were wearing lenses for a long period of time, or even if they were not, suddenly they'll feel that, my eyes are completely dry. Because of that, they start having headaches, itchy eyes, and even, so they feel that tiredness in the eyes because of the dryness which is coming along because of the menopause. Then there is altered sense of smell, So if you want to, sometimes you feel that I was smelling something else and now I'm feeling something else, so that is there. Then itchy ear, you always feel that you want to itch your ear because of the dryness in the ears that happen. Then again, the next thing that happens, which is very interesting, is burning mouth. That is very, very common in menopause. So what happens is, even if you're not eating spicy food, you feel, even if you're eating like a bland food, you feel that as if you are eating a lot of spices. And even if you're drinking water, that burning is not going, so that is also very common in menopause. And actually when patients present to us, they they do not tell us that they have achieved menopause. We have to dig into the history, and the last thing that comes into picture is that, oh, I am menopausal. Oh, periods, I have not got it since so many, years. So then we can relate that it's because of menopause and nothing else. Obviously, the deficiencies also play a major role. If you are deficient in thiamine, biotin, those things also play a major role. But menopause is one of the reasons for the burning mouth syndrome. Then the next thing that happens is, the bones, they become weak. So because estrogen is protecting your bone, it is causing the new bone formation every day when estrogen is not there. So what happens is you start losing bone matter. So you start losing calcium from your bones. So, the bones are getting affected completely. So we call it as osteoporosis, or it is also called as a silent disease of a menopausal woman. Why it is called silent disease? Because you will never get to know till the time you get your first fracture that your bones are osteoporotic. So that's why it is very important to get them screened every now and then, that whether they're in a good health or not. Then coming to the heart, obviously estrogen is the biggest supporter of the heart. Till the time estrogen is there, nothing is going to go wrong with the heart. But as soon as the estrogen is withdrawn, you are very prone to heart disease. You're very prone to heart attacks, because the protective hormone has gone. It is completely gone to nil. So, that's why it is important to get your heart screened every now and then when you're menopausal. Next, coming down to your digestive system. So you can have, because of the decreasing hormones, there is a complete dysbiosis in the intestines, in the GI bacteria that happens. And because of that, there is a complete decrease in a good or a healthy bacteria, or a variety of bacteria in the intestines. They decrease, and because of that, the female can experience constipation, new onset of constipation, new onset of diarrhea or bloating. They come to us saying that every now and then I feel bloated. Whenever I have even small quantity of food, I feel bloated. So the reason is because obviously there's a complete dysbiosis in the intestinal microflora, which is happening on everyday basis. Then coming down to the genitourinary syndrome. So a genitourinary system. So even your bladder, urinary bladder, your kidneys, they are affected by the estrogen deficiency. And because of that, a female can experience recurrent UTIs in menopause. And then there is, a thinning of the vaginal epithelium, the lining of the vaginal epithelium. And because of that, they can have a constant itching in the vagina. They can have, dryness in the vagina. They can have pain while having intercourse. So these are the few symptoms they experience during the menopause. And as I've told you, the fat distribution, even the fat distribution, that changes when you hit the menopause. Why? Because there is a new onset of insulin resistance that is developing, and because of that, all the fat which was there in your arms and legs get accumulated and comes around your belly. And that's why we call it, it's like a satin ring around your belly, which has developed because of the new onset of insulin resistance and because of the changing hormones. So yeah, these are the few symptoms that we range, starting from it's not to scare you, but it's just to make you aware that these are the things that can happen when you enter the menopause. Then one of the most important symptom which no one talks about, or everybody's shy to talk about, is urinary incontinence or urinary leakage that happens during the menopause because of the weakening of the pelvic floor muscles, and also because of the thinning of the bladder and thinning of the bladder muscles. Because of that, they can have urge incontinence or stress incontinence. So these are the few things, I think, that I hope I've covered everything. These are the few things that most of the menopausal women, they experience, and these are the most common symptoms they come to us for.
No, that's my eyes were also open to some new symptoms. The itchy ear I'd never heard about, but that's really amazing that it really affects every single organ kind of thing. Estrogen is so protective. No, that's actually, we covered a lot of the questions during what you said right now. But one of the questions that the audience, somebody had asked, is how do you control these irregularities in bleeding, and can you actually control them? during this perimenopausal phase?
Irregular bleeding is a very common thing to happen, and it's a physiological phenomena which is happening. So unless or until it is affecting you mentally and physically, or it is causing you, the bleeding is so much that it is causing the decrease in hemoglobin, and you are suppose if you're changing your pads every 2 hours, so if it is affecting you literally, bodily, mentally, then we need to evaluate it and correct it. But if it is physiological, suppose if it is coming after 4 months or 2 months, and even if you're bleeding for like 7 days or 8 days, but bleeding is not so much that it is affecting you completely, I don't think we should, alter anything. But yes, if you feel that this is not normal, the bleeding is not normal, it is very heavy, then you should get evaluated. Maybe that's some early stages of some endometrial cancer, or maybe some endometrial hyperplasia which can later go into cancer. That can be evaluated and treated during this time.
Okay. And one of the other questions was during your practice and what you've seen, I know this is very general, but approximately at what age do we start experiencing these perimenopausal symptoms?
So usually, previously, we used to say that in India, females used to attain menopause at the age of 52, 53, but now there is a dramatic shift, and now they are attaining menopause at a much earlier age, by the age of 48 years or 47 years. And we say that anybody who's attaining menopause around 48 years can experience their menopausal symptoms ranging from 2 years before to even 10 years before. So it's a very wide range, but it varies from person to person. But yes, the range is between 2 to 10 years. Definitely 5 years before you might start experiencing these perimenopausal symptoms.
Okay, that's good to know. I think that's why we want to do these awareness seminars, so that people can know that, to kind of track their symptoms and kind of spot these changes
Absolutely.
early
Yes.
on. And one of the questions was, I have got it at early age at 42 and see lots of mood swings, inability to focus, and I really want to come out of the side effects of it. So what would you suggest for this person?
So if you are in a perimenopausal phase and if you are experiencing these mood swings and all these symptoms, then you are the right candidate for HRT. So HRT, the important thing to know about HRT is that is the hormone replacement therapy is when the hormones are getting fluctuated, right? So we give the hormones from outside so that the hormones become stabilized, and the mood changes which are affecting your life, which are affecting you physically, mentally, you will be able to come out of it. We will not be able to start you on HRT when you are postmenopausal for 10 years, 15 years. Then if you're getting some symptom, then we won't be able to help you with the HRT. So perimenopausal time or maximum 1 or 2 years post-menopause, it's the ideal time for anybody to start on HRT. And actually HRT is like a boom, you are actually giving the hormones, you're replacing the hormones which are causing all these symptoms. So it works wonderfully, especially with the mood changes, especially with the vaginal dryness, especially with the hot flashes. So they literally work wonders. So if somebody is having these mood changes and everything, and during this perimenopausal time, HRT will be the ideal thing to be started.
Yeah, coming to HRT, I think it's a seminar all by itself. But for India especially, why do doctors refuse to prescribe HRT or birth control pills, even for women in their early 40s who are not at high risk for cancer or cardiac problems? Shouldn't the risk and benefits be assessed on a person-to-person basis? And the follow-up question is, are there any studies on the effect of HRT on Indian women? So maybe we should start by just saying, why is there so much problem with prescribing HRT in
Actually, you know what? It's not about prescribing by the doctors. It's also about the patient. Because nowadays patients have become so tech savvy and they want to know everything from the Google. They gather all the wrong information from the Google. Google will tell them that if you start on HRT, you will get breast cancer, you will get endometrial cancer, you will get, ovarian cancer. So when they come to us with the closed mind saying that, oh, please, I don't want to start on birth control pills. I don't want, you tell me something which is beyond this, and not something related to this. Or they don't want to start HRT. the HRT is actually a big deal. Even if I tell some PCOS patient to start on birth control pill, they'll be like, no, I don't want to start on that, because if I'm going to start on that, I'm going to gain weight. I'm going to have, so, it is the block in both the directions. It's not only from the doctor, but also it's from the patient side, that, that they don't want to understand that whatever Google is telling you and whatever advancement actually the medicine has made. Now we have got medicines which are so low dose that they're just gonna, give us the effect what is needed, and the side effects are so less. And when we actually do the risk benefit ratio, so the benefits are much more than the risk. So, that's why it's actually both ways. I wouldn't say that it's only the doctors, but yeah, it's both ways.
Okay, so that's,
and about the studies which are being done on Indian women. So I think on HRT itself, the studies done are very, very less. On actually the whole menopause, the studies done are very less, because this is a topic which nobody wants to talk about somehow. I don't know why, but yeah. And there's only one trial which was actually, it was a 7-year-old, 7 years trial, which was the women health trial, women health initiative, which was done. And for 10 long years, we had no update from that, or no advancement was made on HRT or any new guidelines on menopause. But recently, actually, one study has come up, which is not specifically on Indian women, but yes, they're saying that if we start somebody on HRT within 2 years of them attaining the menopause, or when they are in perimenopausal period, then they can have way more benefits as compared to the risks.
Right. So that's good to know. So I think everybody in this call, please consult your gynecologist about it, and at least have a discussion with them on the risk and benefit ratios, and then decide for yourself. So I think that's important. But taking a step back from HRT, so there was a question about, and this kind of ties into what Miyara does, but I would love to hear your opinion on how do we prepare physically, mentally to face the transition symptoms many years before it starts, and what positive changes we can expect to enjoy after menopause.
So, I was when I was doing a fellowship in menopause. So when I was reading all about menopause, so I thought on myself that if I'm not doing anything about it now, I'm gonna have a bad menopause. So the most important thing is, I think, regular diet and exercise. Not diet, by diet it doesn't mean that you are on some crash diet, or you are on some particular diet throughout your life. No, I mean by that you have to take a nutritious diet which is rich in anti-inflammatory foods, which is rich in calcium, which is rich in vitamins, which does not include alcohol, smoking, and also at least 4 to 5 days in a week of exercise. And that too, 45 minutes to 60 minutes of exercise for 4 to 5 times in a week is very, very important. Because as we age, our bodies start to develop insulin resistance, and that insulin resistance worsen all the symptoms, whether it is hot flash, whether it is mood changes, whether it is gaining weight, whether it is gaining all your weight around your belly, whether it is metabolic syndrome, which you're going to develop after menopause. So everything worsens, and the only thing that can help to deal with menopause in a better way and to enjoy the menopause in a better way will be if you start taking care of your diet and your exercise on day-to-day basis. It's diet doesn't mean that if you have a wedding at home, you do a crash diet and just lose weight. Diet is never about weight, and you should never think about your weight at all. Weight is just a number. It's not about your weight, it's about your own health. And what we see, the fat what we are seeing outside doesn't count. Actually, the fat which is there around our organs, that is the visceral fat, that is the one which will be responsible for insulin resistance, for all the menopausal symptoms, for everything. That visceral weight will only go when you're doing exercise and following a nutritious diet.
Mm-hmm. I'm so glad you said all these things. I as soon as a doctor says it, then people kind of take it as an important thing. If anybody else says it, they're not, they don't take it seriously. So I think
Yeah.
a lot
So
of
that's why
information.
I think if we start planning it from even our reproductive years, then only then the symptoms will be less. Then you might not experience those, major symptoms like mood swings and hot flashes, and all those things will not come in that grave manner the way it will come if you're not doing anything about it. Even your bones will be maintained if you're exercising. Your muscles will be maintained if you're exercising, if you're taking a high protein and a good diet, rather than just going on crash diets or not eating anything throughout the day or for weeks, times, and not taking care of anything. So that's going to make it worse for any menopausal. And even your history, when your diet and exercise is good, then you will not have PCOS, you will not have hyperestrogenism, you will not have any kind of cancer. So everything is related to your lifestyle.
Correct. That's absolutely true. I'm glad you mentioned that. There is also a question now on the chat. Any mental health issues to watch out for? Lakshmi has asked this question.
Yeah, so and if you previously had, like, PMS or premenstrual dysphoric disorder, or if you have history of anxiety, depression, or schizophrenia in your family, then during menopause all these things, they get precipitated, because as I told you that estrogen and progesterone is either in the declining phase or in the fluctuating phase, and because of that the happy hormones serotonin and norepinephrine are getting affected. And so any sort of imbalance or any sort of psychological abnormality which is there in your family or in you, if you had a personal history, then it might get precipitated during menopause.
Okay. Lakshmi, I hope that answered your question. The other, so anybody else who has questions, please do post them in the chat. So Gayatri says, so what can we do about it? So once we have the
Therapy, if it is affecting you completely, if
hormone.
the anxiety, depression, and all these things are precipitated in perimenopausal or menopausal in the early menopausal phase, then hormone replacement therapy is an answer to it to some sort. And definitely psychological counselings with the psychologist are very, very important.
Okay.
And to realize that you have this problem. Like, some people do not even realize that they have depression, anxiety, and all those things. To realize and to seek help is also a very big step and a very big, important thing.
That's absolutely true. I think a lot of people just lack that self-awareness, and once they have the awareness, it's good for them to seek help or know that there's help out there. So that I think that's a very important part. But the other question that we had was, is there a connection really between PCOS and menopausal symptoms or changes during menopause?
Yeah, so there's not the connection is in a way because PCOS is a hyperestrogenic state, right? Where the estrogen levels are high. So if you have PCOS, then you might have, delayed menopause, or you might have increased incidence of endometrial cancer because of the hyperestrogenic state, and if the PCOS is not kept under control. And if the periods are not kept regular, because sometimes I have seen patients coming to me saying that for 1 year I'm not got periods. The lining has to shed, right? If it is not shedding on monthly basis, it's gonna get problematic. It's gonna get problem later on in life. So if you have PCOS, then the incidence of metabolic syndrome, insulin resistance, menopausal symptoms becoming worse, like hot flashes because of insulin resistance. So it's all connected.
Okay, that makes sense. But what about, like, a lot of people don't talk about it, but what about contraception during the perimenopausal phase? Like, should one be using should one be using birth control?
Absolutely. Birth control should be used 1 year after the menopause. Like, suppose if you've not got your periods for 1 year, till then you should use your birth control pills.
Okay.
Because till that time you are actually, the egg is getting released very randomly. So perimenopause is the time when we have seen patients coming with the accidental pregnancies the maximum, because they think that, oh, now I cannot become pregnant, now my periods are so irregular. And that's the time when they become so lenient, and that's the time they come with to us with the maximum unwanted pregnancies.
Okay, that's good to know. So I think a lot of people have that misconception about not not knowing that they should be on the contraceptions, even though their periods are irregular and things like that.
Absolutely, absolutely,
But a
yes.
lot of people that we've spoken to have also had this problem of heavy bleeding during their menstrual cycle. So, I mean, during these perimenopausal phase, so they have noticed other symptoms, so they know they're perimenopausal. So, how does one deal with that? Or should you be consulting a doctor about that and checking?
Yes, yes, they should consult the doctor, get them evaluated that why they are having this, heavy bleeding. Definitely it's hormonal, but if it is affecting them completely, then we need to treat them for that. We can't just leave them just because it is perimenopausal.
Okay. So there is,
Anything that is affecting your life in whatever ways, even in a minor ways, it needs to be corrected. Even if it is physiological, understood, but it has to be corrected. So what we do is we have got a very beautiful device now, which is called as a Mirena. So what we do is somebody who's having perimenopausal heavy bleeding, which also comes under abnormal uterine bleeding, ovulatory, that is because of the hormonal changes that's happening. So the Mirena is like copper-T. What we do is we put it inside the uterus. So it has progesterone in it. That's the hormone against estrogen. So what it does is it decreases the thickness of the lining of the uterus. So it does not have any side effects to the body, and it is locally acting on the uterus and decreasing the lining thickness of the uterus, and the heavy bleeding will reduce then. So Mirena is like the wonderful thing that has happened for the perimenopausal patients, because without side effects it is controlling the bleeding.
okay, that's, yeah, I've also heard about Mirena. There's also another question. Do women get all the symptoms or multiple symptoms? If it is only one symptom, do we say we are in perimenopause? So that's one of the questions. And are there bioidentical HRT and the recent medications available in India?
So symptoms, anybody can experience any symptom, and there are people who have not experienced any kind of symptom also. So it depends entirely from person to person how their reproductive years were, how their pubertal years were, because this, the kind of menstrual irregularity you suffer during your pubertal age group, the same kind of irregularities, the same kind of symptoms you experience during the perimenopause, because that was the start, this is the end. The hormonal imbalance is the same, so it's going to be exactly almost the same. And so it depends entirely from person to person. Somebody can have multiple symptoms, somebody can have zero symptoms, somebody can have two symptoms. So you will know you are perimenopausal when you start getting your irregular periods, because changing bleeding pattern is the first symptom of perimenopause. Or you might have vaginal dryness. That's also like one of the first symptoms of perimenopause, because as soon as the sudden estrogen drop happens, the vaginal dryness starts. So these are the two things that are the most important things when you will know that you have entered into the perimenopause. Coming on to bioidentical substances in India, I don't trust any bioidentical substances in India, because there were many, but I don't think anybody has proven well to themselves. So I think sticking to HRT and sticking to, some things like for hot flashes, we give a lot of pregabalin. That helps, because that's something related to the nerves, and that's something related to the changing hormones and the hormonal axis. So pregabalin does wonders for hot flashes. So that is something which we use as an alternate to HRT. And then obviously the local creams, vaginal creams, which are there, but all of them, like steroid creams, we use a lot for, vaginal dryness and vaginal atrophic vaginitis and vaginal thinning. And, but coming to bioidentical hormones, we don't use any in India.
So there's potential that it could help.
Absolutely, there's a lot of potential, but yeah, there's a lot of research needed on to what is good. There are a lot of things in the market. There are a lot of things even in the books, but everything has a very, it's like a double-edged sword. It has good factors also, and it has a lot of side effects also. So I usually do not recommend any of them.
Okay.
In India.
In India, yeah. Okay, so there's also another question. I think she mentioned about diet recommendations. You already mentioned something about diet recommendations for perimenopause and menopause, the high calcium and things like that.
High
But
calcium, and then even high protein diet, no restrictive diets. You can actually go in for intermittent fasting because it improves insulin resistance and really help a lot of perimenopausal and postmenopausal women to control their insulin resistance. And then even adding a prebiotic or a probiotic in your diet is very important, because that will reduce the bloating, constipation, and diarrhea, because of the dysbiosis which is happening in the gut. So adding a prebiotic and probiotic really helps.
okay. And the other question was, between the copper tea and birth control pills, what is better to help regulate periods?
So if you are asking about perimenopausal time, then neither copper tea nor birth control pills. I would recommend Mirena.
Okay. So
Mirena is also a kind of copper tea only. It is a medicated copper tea, I would say.
Okay. And that is lasts for 5 years, from what, or how
It
many?
lasts for 5 years, yes.
And it's progesterone only, is that?
Yes, only progesterone.
Okay, that makes sense. Does anyone else have some questions? Please do drop it in the chat, or you can also unmute yourself and ask doctor your questions if you do have, because otherwise we can go on to the questions that we have here. Oh, sexual activity is affected in menopause. Your comments.
Absolutely, because of the vaginal dryness and because of the low sexual desire and because of the changing hormones, hot flashes, mood changes, all of them, that first thing is affected is sex. That's why, and the least talk about topic, because people don't give importance to sex during that time, but actually it's very important, because if you have regular sexual activity, that will maintain your vaginal epithelium and that will maintain blood flow to your vaginal epithelium and hence prevent atrophic vaginitis. So yes, it is affected, but if you consult and if you get it treated, then this is the best thing which can happen to a menopausal patient.
So get it treated, when you say get it treated, do you mean like HRT again, or is there other ways that
local creams we give, local estrogen creams, local steroid creams, because the thinning, we have to regrow that epithelium, right? We need to maintain the blood supply without any side effects. So we give a lot of local vaginal estrogen creams and local vaginal steroid creams. So I give a 6 weeks treatment of steroid. It comes by, in India, it comes by the name of Humason. So I give it like, first 3 times a day, 2 times a day, and it has a beautiful result without any side effect. If I get a chance, I'll show you the picture also of pre and post in atrophic vaginitis patients. So it has beautiful results. The itching goes, the feeling of that constant pain that goes, and the feeling of fear of doing an intercourse because of that pain goes, and that small petechial patches which comes up in the vaginal epithelium, those goes. So it has beautiful results.
Okay, that's good to know, so that people can seek, they don't have to shy away from talking about it, and they can go and talk to a medical professional about it. That's
absolutely, yeah.
Preparing family and children about menopause, should we, and how do you go about talking about it? I think that's a brilliant question. Thanks, Kritika, for bringing it up.
So I recently I did a talk on menopause, and there we gave a handouts saying that 10 things husband should know about menopause or men should know about menopause, because it's very important, because then only they'll be able to understand what you're going through. They should know all the symptoms. They can support you in that, especially sex and menopause. It's very important for the partner to understand that what you're going through and what are the treatments that can be given, and whatever is happening because of the reason. If you're going mad, you're going mad because of some reason. It's not because something is in your brain, that's why it's happening. It's the hormonal changes which are happening, and it's for real. Like how I say PMS is for real, in the same way menopause is for real. And all the the behavioral changes, the mood changes that are happening are for real, because it's the hormones which is hitting your brain constantly. So obviously it's going to happen. So all these things, so educating your partners for menopause is very, very important, because that's only they'll understand that what actually you're going through.
Mm-hmm. And in terms of children also, I think when they're old enough to understand, they should also be aware of what their mother or their, people in their family are going through, I think, boys or girls.
Absolutely.
Yeah.
Absolutely.
Okay, that's awesome. I think that's definitely talk to your partners. I think this handout idea is great, actually. That's a good way
I'll
to
send
kind
you
of
the
talk.
picture of the handout.
Yeah, that'll be good. Yeah. So, are there any further questions from the audience? Actually, I had one more question about HRT, actually back to HRT. So the thing is with HRT, because you're, replacing different hormones, do you have to test very often the hormonal levels so that you know
No,
that it's working or not, or is it just symptom based?
you will know symptomatically.
Symptomatically. Okay. So you don't have to tweak it in that sense.
Absolutely no.
Okay. So
You
symptomatic.
don't have to keep doing estrogen, progesterone, FSH, LH, because that's going to change according to the physiology, what's happening. When you are just replacing, you'll symptomatically feel better.
Okay, that makes sense. And everybody has asked us this question about how do you diagnose menopause? So is there a blood test that one can do, or things like
See,
that?
there is blood test, but we don't rely on that blood test. That is the FSH levels which we do, but we don't rely on that. The only thing that can tell you that you have entered into menopause is when you have not got your periods for 1 whole year.
Mm-hmm.
That's
But
when we see that you have entered into menopause. Perimenopause, when you are getting those symptoms of irregular periods, mood changes, hot flashes, vaginal dryness, when you're getting those symptoms, that means you're perimenopausal. Why waste so much of time and money on a blood test just to know that whether I have entered into perimenopause or not?
I think more it's like a mental, like, they once they
Yeah,
see it on the thing, it's just, mentally you feel, aha, okay, this explains it, because nobody's
yeah,
talking about it. So I think it's more that for
yeah,
women, I would
absolutely.
say.
It's mental peace.
Yeah, mental peace. Yeah, exactly. There's another question. Irregularities in bleeding results in being skeptical about physical exercise. Does it have an impact, and can a brisk walk trigger a period?
Brisk walk cannot trigger a period, but any kind of stress actually can trigger a period. Suppose if you were not doing brisk walk before and suddenly you feel that, oh, I want to get up and do brisk walk now. So any kind of stressor, even if you travel, you might get your periods early. So it's like that. And about irregular periods and exercise, you should make a routine not only during your perimenopausal and menopausal time that you have to start exercising. This should be a routine from the very beginning. So irregular periods, you're helping your periods to be regular by doing exercise on everyday basis. So if even during your perimenopausal time, if they're irregular, but if you're exercising on daily basis, the irregularity will be less. It will not be as much as somebody who was not doing exercise before. So that's why preparing for your menopause is important.
Amazing. Yeah, that makes sense. The other thing is, does nutritional deficiencies increase during this perimenopausal period, or should we be substituting, in certain ways during this period compared to other parts of our life before pregnancy and all, we have to be eating differently. But I have found a lot of women having these nutritional deficiencies during this time, whether it's D vitamins or B12 or whatever.
Yeah, absolutely. Because body is not absorbing everything because of all the dysbiosis which is happening in the gut bacteria. And the gut bacteria is everything for us. Like if gut bacteria goes haywire, we are gone. It's like that. So it's not absorbing vitamin B12, vitamin D, calcium, all these deficiencies. And obviously we are losing muscle during menopausal time because obviously the protein is going down. So all these deficiencies, they come up. If you're deficient before, they will become precipitated more now.
Mm-hmm. Yeah, that's true, because I've also heard about this, and one should. And what is your answer about whether one should supplement during this time? Should we be checking our blood, having a blood check, checking our blood levels every 6 months or something like that? Or
So annual checkup is good. And usually all Indians are deficient in vitamin D. So invariably you should get your vitamin D levels checked and keep taking vitamin D. Calcium, everybody asks me that whether we should take on daily basis if they lead to stone formation and everything like that. So if if you are menopausal, the ideal way is to take it for 3 months, give a gap of 2 months, take it for 3 months again, then give a gap of 2 months, so that whatever is needed by your body will be absorbed, your stores will be replenished, and then to prevent the side effects, you can give a gap of 2 months and then start again for 3 months, like that.
Okay, so supplementation when required, basically. And should
Yes.
we be testing our hormone levels or not? Like, what is your take
No.
on? It's
I
just
would, because see,
expensive.
in India, we are already, patients are not very keen on in getting investigated because of all the, financial issues. But even if you're financially stable, these are just unusual tests. These are just stupid tests for your mental satisfaction, nothing else. Because see, even if you know that you're perimenopausal or menopausal, how it's going to change your life? We need to treat you symptomatically anyway. So let's just see the symptoms rather than seeing the lab results.
Yeah.
Anyways, those lab results are not going to change our treatment in any ways. It's not going to tell us that, whether we should start you on HRT or not. It's not going to tell us anything. So why get a blood test done? Just let us just concentrate on symptoms and treat it accordingly.
Yeah. So then when a woman comes to you, so what would you recommend, like for all the people listening in, like what would you recommend they start doing in terms of tracking and, things like that? Should they be doing something special during this time so that, when they go to the doctor, they can give this information to the doctor, for example?
So if they have irregular periods, it's important to track your periods, to write how many days after you got your periods and for how many days you got your periods. And if you got your periods, how many hours you're changing your pads. So all these things, they will tell us the intensity of how much of the, how much intensity of symptom you are experiencing. And if you are experiencing mood changes, whether they're present all the time or whether they are related to your periods. So, tracking of things is very important, because when you track things, we are coming to the diagnosis then, right then and there itself. Then we need not to investigate you further.
Yeah. But what is happening now is, I think a lot of women have told us this also. They come, they track their symptoms, they go to the doctor, and they're often dismissed, right? Like the doctor says, no, you're too young, or this is not the, the right time. Why are you talking about this at this phase? So there's a lot of dismissal by medical professionals or like people around them. So not only, let's not put the blame of only medical professionals, but so what do you have to say about that?
Yeah, I understand that, because a lot of, we are not taught about menopause during our, PG times. It's just like a small lesson which we read, and we don't get a lot of weightage about menopause because it's a physiological, endocrinological thing, and more endocrine people also, they talk about it. And or all these symptoms, they come more towards something related to medicine, or not something which is related to, so that's why we don't learn more about it during that time. So that's why I think half of the gynecologists, they don't have knowledge about all these things in detail. So that's why when they're coming, they're going to them, they don't understand that what to, when you don't have anything to say on it, you dismiss it.
Yeah.
So half knowledge, when you have half knowledge, when you don't know much about it, you'll be like, it's okay, let's just not deal with this right now.
Yeah.
So that's the reason, especially in India. We don't have menopausal clinics in India. We
Yeah.
don't run any menopausal clinic. It's like if you either you go to your physician or you go to your gynecologist, or you don't know whom to go to, or you're just going to your psychiatrist, because the symptoms are more medicine based or they are psychological based. So even the patients don't understand whom to go to, and because of that, they get lost.
Yeah. So
And the symptoms are so varied. Suppose if you're getting a constipation or diarrhea, you will not go to a gynecologist.
yes.
But actually, it's a thing of the gynecologist, because if you're menopausal and if you're getting that bloating, constipation, diarrhea, new onset, then a gynecologist has to deal with it, and not somebody who's related to GI. Somebody who's related to GI will only treat diarrhea, constipation, and bloating, and will not go to the root cause of it.
Exactly. And someone dealing with something else will not, hair fall.
Yeah,
For example, hair fall.
Yeah. Somebody dealing with psychological symptoms. If suppose if I have anxiety, I'll first go to a psychiatrist without thinking that it could be perimenopausal or menopausal, and maybe I can go to a gynecologist, start something better. So lack of knowledge, even among the medical professionals and even among the normal individuals, is the reason why menopause is so neglected, and we do not relate it to menopause. Actually, most of the symptoms can be just related to menopause and can be sought then and there itself. But when we are not relating only to menopause, then how we can
I will,
actually treat it?
correct. That's true. That's absolutely true.
So one of my actually very close friend of mine. So I was just telling her about the symptoms of menopause, and so she told me, you told me about burning mouth syndrome. What are you saying? Is it related to menopause? I was like, yeah. She herself is a doctor. Did GI from Mayo Clinic, and then she's like, you know what? I got my mother was suffering from burning mouth syndrome since almost like 6 months, and I've been treating her like crazily and not getting results of anything. And we were just thinking that maybe it's biotin deficiency or this deficiency. I had talked to this GI specialist, I had talked to this, but they never thought that it was menopausal, and maybe they could have just given something related to menopause and we could have just managed it right then and there. So even the doctors do not know that these are the symptoms which are coming because of menopause. So if there is no correlation, then how we can come to a conclusion or come to a proper treatment?
That's why it's so great that you're talking about it, and we are putting forward these awareness sessions that at least 10 women can take away something, and we'll publish it, and so more people can find out about it. But there's one last question I think we should take. Does it impact sleep pattern? And I think you kind of mentioned this, such as not being able to sleep or just very exhausted, sleepy during the day. So
yeah, obviously because of the night sweats, there is inability to sleep, insomnia, anxiety, depression, all those things, they precipitate sleeplessness. And because of, obviously, when you're not sleeping at night for the whole day, you will feel sleepy. That's very normal to happen. And even the hot flashes, they drain hell out of you, so you feel uncomfortable, you don't feel good about it. So that's why you're sleeping the whole day, and that's the reason. And even there is new onset of hypothyroidism during menopause, so it could be because of that also. So whenever we are suspecting somebody perimenopausal, should get their thyroid levels also checked, because new onset of hypo or hyperthyroidism can also lead to these kind of symptoms.
okay, so there is a relation between the thyroid and perimenopausal.
Absolutely. There can be a new onset of hypothyroid or any kind of thyroid imbalance which can happen during menopause.
Okay, that's interesting. So I think we covered a lot of topics. I think we could talk for a couple of hours about this, doctor, but any parting words for like our audience and, just people tuning in today?
I think the most important thing is that we should talk about menopause and not shy away from it. It is just a physiological phenomena. And the more we talk about it, the more we learn about it, and the more we'll be able to treat the symptoms in a much better way.
Great.
Especially the incontinence, especially the hot flashes. People don't want to talk about it, but we have treatment for everything. You don't have to suffer just because it's menopause. We can make your menopause much more beautiful and satisfactory and comforting.
Yeah, that's true. You don't have to suffer in silence. I think that's really the key takeaway. You can seek help. So I think great. I think that was really great. Thank you, doctor. I think that really informative session, and you really helped kickstart Menopause Awareness Month for us. So I'm really happy that we could do this together.